Now, health officials in this country say 5 people have died as a result of a salmonella outbreak linked to cantaloupes. The number of confirmed infections is also climbing. Cases are being reported in 6 provinces and in dozens of U.S. states. The CBC's Natalia Goodwin is on the story for us from Ottawa. So what more are you hearing from the Public Health Agency of Canada about this outbreak?
Yes, well, the agency isn't saying much else about those 5 deaths. They're not releasing which provinces those happened in. But what we do know is there are now 129 lab-confirmed cases of salmonella related, they believe, to these cantaloupes. So that means that the cases have now doubled since last week, since the last update from the Public Health Agency. Now, as you said, this covers 6 provinces. So they are BC, Ontario, Quebec, PEI, New Brunswick, and Newfoundland and Labrador. And you can see on your screen there how many are in each province, with Quebec having the most amount of cases at 91 right now. In the U.S., there are also 230 cases across 38 states, and that country has seen 3 deaths believed to be related to this outbreak. Now, the most people that are getting sick are those children under the age of 5 and adults over the age of 65. And this has to do with 2 brands, they believe. So they have recalled those 2 brands. You can see the logos on your screen there. Malichita brand sold between October 11th and November 14th, and the Rudy brand sold between October 10th and November 24th. So health officials are saying if you know you have those in your fridge, get rid of them, either throw them away or return them to the store that you bought them from. Or if you're not sure if they have to do are those brands from those time periods, err on the side of caution and get rid of them anyway. And we also spoke with a expert on this, Dr. Isaac Bogosh, and here he is with a little bit more about what we should be keeping in mind with this outbreak.
This is certainly a transmissible infection, and people that have salmonella infections and other gastrointestinal infections can transmit it to others. You know, it's not nice to talk about, but this is infectious diseases in the world of medicine, but it's transmitted through the fecal-oral route. So that can include through poor hand hygiene. So it's really important that people have impeccable hand hygiene, not just for the prevention of this infection, but for the prevention of so many other infections as well.
He goes on to say that you should be keeping a lookout for the symptoms of salmonella, which are similar to a gastrointestinal disease, things like nausea, vomiting, diarrhea, fever, chills. And if you have those, he recommends going to see your healthcare provider to get checked out, because it could be something else or it could be salmonella, and salmonella has a very specific course of action to take. So make sure you're getting treated for the right thing, Arthi.
And I guess another big question here is whether or not we have a sense of how these cantaloupes became contaminated in the first place.
Yeah, that's right. So again, the Public Health Agency not saying much about whether they know exactly how this started to happen, but experts say that, you know, this contamination can begin anywhere along that supply chain. Here is Dr. Bogosh again on that.
When we're dealing with any contaminated food product, you have to think about the very origin of that food product and any point along the chain where it has been touched or processed until it's finally consumed by an individual. The very likely source here is actually at the site of origin at the farm, and it's common, unfortunately, for these to be contaminated with feces of animals, and that feces is contaminated with salmonella, and that's how the fruit gets contaminated.
And something else to note here is that the Public Health Agency of Canada has actually issued a secondary recall in regards to this. So that's on any products that may contain those brands of cantaloupe, so things like fruit trays, or any products that could have come in contact with them in facilities as well. So things like pre-cut pineapple, pre-cut watermelon as well. People should be on the lookout for, Arthi.
Natalia, thanks. This is the CBC's Natalia Goodwin reporting in Ottawa.